challenging to you, but it's something that's necessary to need to be done. Then go to the other side and they give you a quick breakdown, and so the person's going to look at it weekly. You wonder why weekly you got to look at the same thing, because it's supposed to be reflected in your everything that you do with communication related to the SBAR. Also, please see assigned concept map and care plan due dates. And you see that concept map 1, care plan 1. And this is just for that period. Normally for the 15-month period, which I'll be showing you another thing, is that you have to do it twice in a 15-week period. Now, what you're doing here is only for one instructor. What you have here is for the med-surg instructor. You have to do the weekly also for the person who's teaching psych. You have to do that also. And they want to see the same thing, basically the same thing that's there. So you may have to do several of these every week. Because each one of the instructors, and like I'm the only instructor you have here. In college, no. You have several instructors and each one of them have their specific area. And you got to give them the information. So this weekly thing, I guess after time you get used to it and know exactly how to approach it and what is required of you. But what you're doing here now is for you to have an insight what is expected of you. Remember I gave you those things up there? Self-evaluation and student evaluations? Mm-hmm. That was the rationale and the reasons. So you can understand. If you read things and you understand and see it, you know what is expected of you in the workplace and out there. Mm. Okay? All right, so as I said, I'm not going to be asking it right away. I'm going to give you now a medication prep sheet. You will make copies. You'll make copies. And you will make copies because you will select drugs in your pharmacology based on each of the different systems. We talked, like yesterday we talked about respiratory, right?
Yes.
So you have to do what? Bronchodilators, isn't it so?
Right,
Yes.
Right, so you need to put down all the bronchodilators, and you're going to see on it exactly what you're required to do, and then, so you make several copies, please. Make several copies.
And what we do every week, we give you one, or?
The weeks are coming very short, so I'll tell you exactly what you need from you. But this is to reinforce the pharmacology that you do, and for you to be informed.
It's good, you know. It's good what you do.
It's good?
Because that way we will remember.
That's true.
Because Jagoxin, whatever the name of it is, the heart rate is lower than
Done,
60. You're not supposed to give it.
Cardiovascular, right?
You remember?
So you look
It's
for the
help the
cardiovascular
heart to
medication.
pump
So
the
what
blood.
part it plays?
Talk to this one.
You did a central nervous
Jackson.
system.
You remember?
Medications affect there.
If it's
We're
your
doing
rate,
the,
the heart rate is, it's gonna do the job for the
endocrine
heart,
system.
to help the heart to pump the
Whatever.
blood. But at the same
Make
time,
at
it's
least
lower
10
the
sheets,
rate.
please.
If
10 sheets?
it's like
Yes.
lower than
Make at least 10
60,
sheets.
the pulse is 60, you're not supposed to give it.
You have 9 systems, right? Make 10 sheets.
All
now
this
let's
we have
quickly
to
go over
know.
it.
This is very
And just look at the front of it.
Injection, right?
You have the brand name, the generic name, and the classification of the drug. Especially, I want you to focus on the classification of the drug. What is basically this drug is about. Okay? Then you have what is the expected action. What is it when this
Side
medication is
effect.
being ordered by the doctor? What is the expected action? That is how it's going to affect the patient. Then you have reason prescribed. Why was this medication prescribed? If the patient is having wheezing, and you give this patient albuterol, the albuterol does what?
Clear the lungs.
Dilation. So, reason for prescribed,
Dilation.
dilate and relieve what? SOB. Then you have potential side effects. So you got to be reading that medication. You guys are with me? You have to be reading and understand that medication are those medications that's being used for whatever system that we spoke about. All right, this is reinforcing what Ms. Lindvall had done with you with reference when she came and she did, I think, 2 days of pharmacology, right? And as we were going along, we talked with certain things and we put certain things in place, all right? Got yours? All right. Then you look for potential side effects. State at least the top 3. What are the top 3 side effects of drugs? So basically, you got to be researching your drug. And the nursing considerations. Remember, everything is about what? You
Nursing
as a
consideration.
nurse. What is a nursing consideration?
Yes.
What is it
I
that
put
you're
that.
looking for?
Yes.
Okay?
Your objective.
This one? I just got
Right,
this one.
whatever system. Each sheet is only dealing with one specific system.
This
So on
one.
this here, you can do actually 1, 2, 3, 4, 5, 6. You can do at least 7 drugs on this one sheet,
For one.
right? For one system. Don't. That's why I tell you to print how many? 10 sheets, right?
Okay. Now I understand.
And now when you go to the back and you turn over, this is how the patient worksheet works, right? When you're with your patients and they're given medication, these are the things that normally, when you're out in the college areas, this is what they want to do. So let's look at this.
Let me see.
Okay.
I don't want you to, what should I say, write anything here. I want to understand why this is doing that. Why you do this. Because it actually be working with what?
Oral
Patient,
medication.
and not working the book. And how it will now apply to you.
Don't hold the
You
medication.
guys understand?
Okay.
Guys, I don't want you to be writing anything in the back here. I want you to just understand. Okay?
Also,
As
don't write
wise
in the
as
back
you-
here.
Right, don't write nothing in the back there. Like when you do this here, you can do
So don't write nothing.
a patient
Don't write
below.
nothing here.
You can do a simulated situation where you do a patient,
But you have to
and this
understand
page look up one of the in your textbooks or even online. When you take a patient and you said, okay, this patient has COPD, or this patient have congestive heart failure, and they're this age and and they be put on this medication. Then you look for what signs and symptoms you expect to see in this patient. Then you're going to see how it affected the back here. This will be your guide. Guys, sure you understand what I'm trying to say? This is a guide. This is a guide you, as a nurse, things that you need to be doing for your patient when it comes to pharmacology. Because a lot of times nurses get more involved in thinking the medical aspect. You don't want to think medical aspect. If you look at the NCLEX questions, it's not medical aspect, it's what you do as a nurse. Okay? So please make at least 10 copies of those, because we'll be working on that.
Okay, I gotta type it down.
Now the first sheet, the second sheet, this third sheet, this is what you're gonna give back to me because I have to utilize this. I'm making too many copies. What I want you to do is look at this.
I'm gonna take a picture of it. This is my real program. Just copy this. Stop whispering. Talk.
All right. Stay with me, please, so we can get through this as fast as possible. Stay with me, guys. Now, you see what is marked at the very upper corner? It says what? A course calendar. And basically, that's what they do for 15 months. But what I want you to look at, and because remember, this here is just for one med surge. This has nothing to do with anything else. Now, week 1, it says what? Review what the syllabus is about. The basic nursing concepts, because everything you do in nursing, we says what? Basic concepts. Then you do health promotion and maintenance. That's just, but look at the evaluation of outcome. Prep U. Prep U is based on, I think I told you guys before, whatever what.
You did in class.
No.
It's the test. They give you a test.
Based on the book, whatever manual you have, Prep U is based on that manual, not in any other manual. And you have to pass each quiz before you can move on. And they tell you every week what's needed. And if you go through it, and I'm not going to be running all through this here, but look at what you have here. Homework Prep U, concept map in week 2. Week 3, homework, exam, Prep U. Prep U. Homework, Prep U, exam. Concept map. And that's throughout the week, the 15 weeks, just in one. Now, if you look at the different topics, and this is where I really want you to focus on now. We already look at 1 and 2, meeting the needs of the client with vascular disorders and peripheral circulation. Care for the patient with hypertension. All is done in what? 1 week. Meeting the needs, week 4, meeting the needs with what? Diabetes mellitus. Manage dermatological conditions, integumentary system, and you go through each one of those. And if you look at it, it means what? In 15 months, you're going over what? Not 15 months, I keep saying it's 15 months.
15 weeks.
15 weeks. Do you see how many topics are being covered? Do you just look at the amount of each week is something that is quite what? Different. Very different. And the course outcomes, that's based on the what? Your manuals. Stanley give you guys manuals, right?
Jesus.
Those textbooks.
The big
I didn't
ones.
get that.
Give everybody textbooks.
Oh, you mean the
I
textbook?
have it from my school, but I didn't.
Oh, you mean the textbook?
Everybody should have textbooks.
But I have it.
Anyway, your prep use will be based on that. Normally, most schools look for left nipping cut. All right? The one that you guys use is a little different. But what I want you to look at under those 15 is the different what? The different subject areas each week. And you see that final exam? You don't pass it, that's it. No two ways about it. And that's not to scare or just to let you know. That's why a lot of people are coming to these classes because they can't make it in the college. A lot of them. Because in college, for the associate you're doing right now, you have to have the NLPN before they accept you in. A lot of them cannot do this, so they what? But guess what? When you guys do it here, we also have what? You have people passing, right? I can safely say, I know my students passing. So I don't really, yes, they have all this drawn out stuff and what have you, but if person stay focused on what they need to do and understand what they need to do, then you will not have a problem. But it calls for, like I started with Stanley yesterday, I tell you guys it's 10% in the classroom and 90% at home, right? So and he said, no, because I'm doing some review with some students, and he said it's 25 in the classroom and 75 at home for everybody. So he put it at 1/4, right? What I'm saying, guys, you have to do a lot at home. Why give you these, what I just give you there, to just you understand what is your level, that's the associate level at college. Just so you understand where you're at. That's why they take the papers from you, just want you to reflect on what it is. It is not to put you down or anything like, but just to let you know where you're at. And can you be successful? Yes. I've had students who are very successful. First time they went up, they passed. You could do the same thing too, that's all I'm saying. But you have to study. All right. So let me have the first and last paper.
No, I didn't finish.
All right, I give you guys just what I'm not after the class, just before the end of the class.
Mr. West, is there a way we can get a complete syllable? A complete syllable, not just the first sentence. Syllabus?
Syllabus. It's not syllable.
Syllabus.
If they not give me long now.
No, I can't read the college syllabus. I just give you an example.
I got a syllabus. You want a syllabus? Which syllabus you want? Because each program,
For the entire-
each semester have a syllabus.
Exactly.
Because like when you're doing nursing fundamental, they have a syllabus. When you're doing pharmacology, there's a syllabus for it. The whole program doesn't have a syllabus.
This is
Each
the
program
syllabus?
have a no, that's not the syllabus. That's like a
This is a
one
syllabus.
semester
All right, this
broken
is what the
down.
syllabus looks like. Guys, shh, quiet please. This is what the syllabus, the entire syllabus looks like. And the thing about this syllabus, like for instance, on the theorem, it says prerequisites, Science 101, Nursing 121, CPR certification, and LPN licensure. Core requisites, English, behavior, science. Course outcomes, and they're going to describe the basic concepts of nursing, including, I never read all of that. Program outlines, I ain't going through all that, it's too much. Required text, and that's a whole lot, so I'm going through that. Recommended materials, I ain't going through that, too much. Process ability to access and navigate the internet, use the email, including downloading, saving, retrieving, and attaching files, because you're using these, I'm reading that. Use a learning management system, example, Blackboard or Canvas. This particular school used Canvas. Download, install, run, and operate software on your computer. Create documents using a variety of software applications, MS Word, PowerPoint. I already taught you guys what? Word and PowerPoint. And you should have been utilizing it. Cut, copy, and paste text, browse, upload, and screenshot. And it goes on to requisite technologies. We talked about all the same thing there, respondents, lockdown, and creating documents. I'm not going through that. The activities, assignment, expectations, I'm not going through that. Medication calculations, homework, prep you teaching. Principles like the prep you we just talked about. You have to have chosen chapters and have prep assignments weekly that requires a mastery level of 4 to 6. And all prep assignments must be completed within a specific time frame. And Kaplan.
Let me get whatever service.
Kaplan integrated medical surgical test will take place during week 14. The score will count as 10% of your grade. It is required that you remediate 1 minute per question. And you guys heard that? 1 minute per question.
How come you don't
And when
know?
I tell you guys that this is why
And
you
then
have
you
to
go to the
practice in,
vocabulary right
persons will be like, whoa, no way.
Who's beating me?
I just tell you. Remember.
Okay, attendance, students are expected to be punctual and attend all classes. Arrival date for the examination result is the time for the student to complete the exam. No extension of the testing time will be granted. Additional information stated in the student manual, because
15
if you fail,
mid-clavicula.
you're gone. Conduct. Students are expected to be partners in their educational experience and to periodically monitor their progress in the course. And that's why we do the weekly stuff.
This is one.
Okay? And then you go on to give you the grades, which we've been using here. The D upward to the 8. And goes on and on and I'm not really getting into all of that. So that's what their syllabus is like.
Who gives syllabus at the end of school? Oh, wow. I'm going backwards.
Oh, by the way, tomorrow, on Wednesdays and Thursdays, I'm meeting with graduate students who have graduated from the other classes and already got their whatever, saying they're graduate nurses. I'm doing a review, 4 weeks of review with them, because I did review with them and they're never were my students, by the way. So they are just persons who did what they did, and it was a disaster, knowledge-wise. So therefore, we're doing a review of 4 weeks. You're invited to come.
Son, what's
From- Stay with me. It's Wednesdays and Thursdays from 6 to 9, 3 hours. Because they're graduate students, it's gonna be fast. Because for the 4 weeks, I gotta do 9 systems. And these persons are, I don't know, people need help, let me put it that way. And you guys are finishing next month, so it will be beneficial for those persons who have a problem with concepts. You'll understand what concept is about. And just now you just saw every week you gotta be doing the concept and the concept mapping, right? You guys have not been doing that because I had to teach you concept mapping, all right? Care planning.
Yes.
But I've been telling you all along what you should be doing what? Everything that you do, you should be putting it into what? Care planning
Care plan.
format, right?
Format.
I taught you how you communicate with your patients. I taught you how you communicate with your professionals. You see in the back the sheet you had just now, SBAR every single week. Communication, communication, communication. And another things with leadership skills and group participations and giving your group thing, which is 50%. But, do you guys know that this year, Nurses Week 2022, do you know what is the theme for the Nurses Week?
Hmm?
You have to know how to put it.
Of course. Don't mind me.
You guys know what's the theme? Oh, that's not nice. Look, nursing team, please.
Nursing team,
2022.
2022.
Team.
Look at the very first
Nursing team.
Sentence.
T.
2022.
Mm-hmm.
What?
It's Bible.
Exactly.
Nurse
To
leader.
lead.
Nurse leader.
To lead. So from focusing you guys all the time, leadership skills. Are you registered nurses? You have to lead. And you have to have that. It just don't happen just like that. Some of us are born leaders, and I always say, I know CNAs who are born leaders. They will just step up and take over. And if you were there and you were the RN, they will take your position. Because they'll tell you what you need to do. And I've seen it happen many times.
I did.
They give other people a sign, oh, you take that assignment. And you can't say nothing because that's their leadership skills. That's what you need to hone.
Okay,
They
yeah.
said nurse,
Yeah.
lead.
Not in my units.
Good lead.
Not me.
And you
Not
gotta
in my
start.
units. I'll write you up.
All right, guys. Today we said,
Not
please stay focused. We're gonna be focusing on. Oh, by the way, it's I told you right. Went to Tursis. 2 days. It's optional. Optional means you don't have to come.
This Wednesday? This Wednesday?
Yes. Tomorrow I didn't know Stan sent out already because I got a call all the way from England. A student who's out there on vacation, so she's coming back in on Friday,
Winter?
so she can come to classes
Winter is
for
finished?
those 2 weeks, those 4 weeks.
Then it's having a
I
review
think that's
for previous
dedication.
classes. I know. Yes, that's definitely dedication.
That's a lot of dedication to be away and your
Yes, sir.
vacation, and you decide that you're gonna call me from there. That's the thing. To tell me that, hey, I'm coming back on Friday to sure I come to classes. Because she was one of in the groups who, when I'm doing the review with them, with clinicals, they're totally lost. Totally lost. The thing is, the focus is on things that you basically should know. And I've not gone into depth like how I would just show you what is required on a weekly basis. I've not done it because I know people are going to be like, Stanley, I can't take this anymore, I'm gone. Because it's a lot. You have to work and all kind of stuff. Okay? You got problems at homes and what have you. But at the end of the day, you have to realize that you have a commitment to yourself. All right? All right, today we're going to be doing maternity, what?
Nursing.
So we're doing maternity nursing, we got to know what?
Put them on.
How the person gets pregnant so that they can get a baby, right?
Yes.
So,
We have to give this one back.
You want it now?
Take it later.
so I'll take it later when you guys, I'll give you guys a couple of minutes. By 8 o'clock, please. What if you have to put anything else in? By 8 o'clock, let me know, and then the two papers I'll get from you. All right? Record from you. All right, guys, let's go, please.
How was it then?
Come on, stay focused with me, please. Reproductive system. Because the woman who's carrying the baby, we want to focus on the female reproductive system. So we have done the female reproductive system before, but now we're getting into what? The pathophysiology as it relates to the system. Words I want you to look for and be familiar with is intrapartum and postpartum. Intrapartum and postpartum.
Intrapartum
No, postpartum.
and postpartum.
Right. Keep those words with you.
Intrapartum.
Now, so let's go to the female reproductive system.
What was the word?
Intrapartum and postpartum.
Postpartum.
Intra and post.
Before we get into the conception and moving on, let's quickly review
Got it?
the female reproductive system. So pull up the female reproductive system, please. All right, let's do introduction. So you guys go to the quick video. Video one?
It's too hot?
You hot?
I'm not hot.
You can turn the light off the back. All right, so we see to the quick video on introduction to the female anatomy.
So the idea of this tutorial is not to go into huge amounts of detail, but to introduce you to some of the basic elements of the female reproductive tract. So what we're looking at here is a lateral view of the pelvic viscera. So anteriorly we've got the bladder, behind that we've got the female reproductive system, and then behind that we've got the rectum and the anal canal. So
What did you just focus on just now?
The rectum in the canal.
Right. But he said in front you have the what?
The bladder.
The bladder.
Bladder, right? You know, usually people say my bladder full, and they want to urinate before they have sex,
Yeah.
right? Because right in front is the bladder, right behind it is what?
this reproductive
That's going to be the vaginal,
Vaginal.
canal, right? And then you have what? What's it in the back here? There you go.
behind it.
Once again, guys, look carefully and listen carefully.
Here is a lateral view of the pelvic viscera. So anteriorly we've got the bladder.
We use the word pelvic viscera. You have an idea what the word viscera means? V-I-S-C-E-R-A.
Viscera.
Pelvic viscera. Viscera is talking about the organs that are located in the pelvic area.
Pelvic area, yes.
All right, so when you see the word viscera,
Viscera pelvic.
you're for relating it to the organs. You're going to see words like visceral,
Viscera.
okay?
Into that we've got the female reproductive system, and then behind that we've got the rectum and the anal canal. So you can see the location of this reproductive system in relation to the bladder and the digestive system behind it. So the main parts that I'm going to talk about are the
What is this here? Look at my cursor, right? What is this? What is this?
It's not the door.
Pelvic bone.
The pelvic
What
one
is
is a
this?
bladder. It's like this.
The cock something. Coccyx? Coccyx?
The coccyx.
No?
Who said coccyx just now?
I said coccyx. I said coccyx.
Exactly, you have the coccyx here, and then you have what? You have the sacral coming up here. This here is your backbone.
Because the
Why
bone from the
persons were
bottom.
saying and start talking about the pelvic girdles per se. No, you're not seeing the pelvic girdle. What you're going to see over here, this is a pelvis. All right?
Yes, this is,
And this is your femur.
this is your femur.
Okay?
Mm-hmm.
This is your backbone.
Yes.
This, they couldn't show you that, they could only show you one side now of the pelvic girdle. Right? Because the other side will block it, right?
Mm-hmm.
So you get a cross section. So they were able to show you the bladder, the female reproductive system, which here is the vagina and the uterus. And over here to show you what? That's come down into your large intestines, which is your part of your GI system.
Mm-hmm.
Okay? All right.
But
That's so you
what
can
about
identify.
the one in the top, Mr. West? The one right this side?
That's your fallopian tube.
The fallopian tube.
Mhm. There's the
The one that
ovary.
hold the white thing, right?
With the
Ovary.
green, yes.
Where the green is
that's
going,
Mhm,
right.
Fallopian
That's your
tube.
fallopian tube.
And the ovary there.
That piece is not, okay, let's move on.
reproductive system in relation to the bladder and the digestive system behind it. So the main parts that I'm going to talk about are the ovaries, which are the primary female sex organ, and then you've got the fallopian tubes, or the uterine tubes as they're also known, which connect to the uterus, which is this muscular sac, which is where the embryo develops into a fetus, which develops into a baby. And then you've got the vagina, which opens up in the
Somebody at the door there?
Yeah, we came to get chairs, but there's no chairs.
Okay.
rotate the model around. You can
So now give you a better idea of, now you see the pelvic girdle? When you turn, you see there what?
Due to fallopian tube.
Right? You see the
pelvic.
brown part, oh sorry. You see this is the what?
That's the large intestine.
Large intestine.
And this is the
Bladder.
bladder.
Right, and now you can see the uterus and going straight around the fallopian tubes into your
Ovary.
Ovaries.
And over here you have,
The circum. No, the bone. The
Sacral bone.
coccyx.
that is part of your pelvis.
Pelvis. And then
Bone.
the femur on the back.
And this here is your hip
Femur.
bone,
Hip bone.
right?
Hip bone.
And down is femur.
Femur.
The trochanter,
Yes.
greater and lesser tuberosities, femur, right? All right, let's continue.
Aspect. So you've got the uterus, which we're looking at here. You can see the superior portion of the uterus, which is known as the fungus. You've got the fallopian tubes, and you've got the ovaries on either side. So I've just switched to this model here of an isolated view of the female anatomy. So you can see these white oval shaped structures, which are the ovaries, and as I mentioned before, they're the primary sex organs of the female. So they are responsible for producing the female sex cells for the egg, or the ovum, as it's known. And this ovum is released monthly, and the process of releasing the ovum from the ovary is known as ovulation.
Ovulation.
So the ovaries are actually suspended in the peritoneal cavity by several ligaments. And I won't talk about these here, but it's important to know that the ovaries are intraperitoneal and they release the egg into the peritoneal cavity.
All right. Remember, he said what? Peritoneal, right?
Yes.
Peritoneal cavity. Everything that is in or under your diaphragm is into your peritoneal cavity. And we talked somewhat about the peritoneal cavity. We talked about things like the peritonitis, when those linings got inflamed. Okay? He make it very, he kind of focused it, and he said, don't forget that they are in the peritoneal cavity. And there's a reason why he's saying that. Because a lot of times persons just think now that pelvic cavity. Okay? All right, let's move on.
And what happens is that the fallopian tube have these finger-like projections distally, which are known as
Cilia.
fimbriae. So you can see these
Fimbria.
little finger projections coming off the distal end of these tubes, which are known as the uterine tubes. And these fimbriae are responsible for wafting the egg that's released from the ovary into the tube. So the uterine tube has 4 parts. It's got an infundibulum, an ampulla, an isthmus, and an intrauterine part. So you've got, as I mentioned before, you've got the fimbriae here, and then the wide
I know
distal
these,
part
please.
is known as the infundibulum. And
Infundibulum.
then as we come around, we've got the ampulla,
Ampulla.
which is the middle and longest part of the uterine tube. And it's the most common site for fertilization of the egg by the male sperm. So that's an important point to remember. And then the medial third of the uterine tube is called the isthmus.
Isthmus.
And it's the narrowest part of the tube, and it opens up into the uterus. So where the
I want to go
fallopian
just
tube
this one more
opens
time,
up
guys.
into distally, which are known as
Please look
fimbriae.
at the fallopian
So
tube
you can
so
see
you understand
these
when things happen such
little
as
finger projections coming off
ectopic
the
pregnancies and
distal
what?
end of these tubes, which are known as the uterine tubes. And these fimbriae are responsible for wafting the egg that's released from the ovary into the tube. So the uterine tube has 4 parts. It's got an infundibulum, an ampulla, an isthmus, and an intrauterine part. So you've got, as I mentioned before, you've got the fimbriae here, and then the wide distal part is known as the infundibulum. And then as we come around, we've got the ampulla, which is the middle and longest part of the uterine tube. And it's the most common site for fertilization of the egg by the male sperm. So that's an important point to remember. And then the medial...
And when you're remembering that, Remember now that when that sperm gets into the uterus, it don't stay in the uterus. When the man ejaculates, he ejaculates into the vaginal canal, leading up into the uterus. But this sperm now, remember you have over 20 million sperms. One of them is going to make its way up this fallopian tube. And why is, you got to remember the different parts of the infibulum and the ampulla and the isthmus. But you want to remember the ampulla most of all. Because at the left of the ampulla is where fertilization
usually
takes
takes place.
And that is usually the area that you're going to find what happening that's abnormal. Because it's fertilized in that area, you can get development of what? Ectopic pregnancy. Right? So always remember, it's in the fallopian tubes is where fertilization takes place, not in the uterus. Okay, guys? Right.
Third of the uterine tube is called the isthmus, and it's the narrowest part of the tube, and it opens up into the uterus. So where the fallopian tube opens up into the uterus is called the intrauterine part. So that makes sense. It's inside the uterus and it opens up into the cavity of the uterus. So the uterus is this sac-like structure, this hollow organ which has thick muscular walls. And as you can see from this lateral view, it lies at this kind of angle.
I just want you to know, when he said thick muscular walls, I want you to remember what he just said. Because when you do pharmacology as it related to the uterus, at times to increase birthing process or for other reasons based on whatever they're going to be doing, they will give the patient certain medications. And these medications are known as uterine contractors. They cause the uterus to contract and push out whatever is in there. All right? Uterine contractors. So like you got those sheets of where you'll be doing your pharmacology, please look up uterine contractors. Because that's definitely a part of what you'll be doing. The uterus is very important in that sense. Because you find that there are situations that can occur, like when a woman have an orgasm, sometimes she can feel what? Contractions, right? That is why when you have in maternity nursing, you have women who are high risk. You tell them that they should not touch themselves. That is, do not masturbate. Because when they masturbate, it causes a very strong uterine contraction that can cause the woman to lose their fetus.
I have a question. So, they should not have sex,
I did not say they should not have sex.
Masturbate.
Said masturbation. The mind's a very strong part of who you are. And when you do self-gratification, it's more intense than when you get gratification from someone else. Much, much more intense. Because you remember, there's a saying, happiness is a state of mind. Depression is a problem in the mind. You have problems with sex, you go to see a psychologist because it's all in the mind. So when you put yourself into that state of where you do masturbation, you are creating something that is very, very powerful. Believe it or not. And I remember this lecture from many, many years ago when I was at Pace University doing my this same maternity nursing. That's one of the things the instructor, she insisted on that, telling your female patients, do not masturbate if they're at high risk. All right?
Oh.
Go to the vagina.
look, if you're in med school and you're struggling in anatomy, I have something for you that can help you ace your next anatomy exam.
Really?
So
need to watch that.
You can see the bladder sticking out clearly to it, and the uterus is flexed above it. So there are three parts to the uterus. You've got the dome-shaped superior part of the uterus, which is called the fundus. And this part of the uterus lies superiorly to the point where the uterine tubes enter into the uterus. And then you've got the bulk of the uterus, which is known as the body, and this is the main part of the uterus. And then inferiorly, you've got the cervix of the uterus. So the cervix is the neck of the uterus. So remember in the vertebrae, you've got the cervical vertebrae. So it just refers to the vertebrae in the neck. So cervix is neck.
All right. Please remember, I'm not even letting say focus on the fundus or focus on the body, but I want you to focus on the cervix. In maternity nursing, that cervix, you're gonna hear, gotta ripen before the baby can be born. So, if the cervix do not ripen by the 39th week, you will have to have a cesarean section. So stay focused on your cervix. Very important part of your maternity nursing. And a lot of problems that happen to the female. That entry, the cervix. Also, that's the area where you have what? Cervical cancer. But we're talking now about maternity nursing. Ripening of the cervix is something. Please put down ripening of the cervix so that you will follow up on it. Ripening of the first cervix or ripe cervix. Anyone you want to put. Ripening or a ripe cervix. That is the cervix becoming soft so that you could have that distension happening. For the birth, for the baby's head to pass through the cervical area. All right, just make a note, you're going to read up more on it. Let's go, please.
So the neck of the uterus protrudes into the vagina inferiorly. So you've got the fundus, the body, and the cervix. So I've just switched over to a simple cross-section of the uterus, and I just wanted to show you the cervical portion, the cervix of the uterus. So I've outlined it in green, and it's this narrow inferior portion. And where it opens up into the vagina, it's called the external os. So you've got this external opening into the vagina. And where it opens up into the uterine cavity above, it's called the internal os. So I've just come over to this nice cross-sectional model, and what I want to show you here is the way that the dome-shaped cervix protrudes into the vagina. So you can see this protrusion here. So by protruding into the vagina in this way, the cervix creates recesses around it. So anteriorly you've got this recess here, and posteriorly you've got this recess here, where the cervix meets the vaginal wall. So you've got these pockets around the vagina, and these are known as the fornix. So you've got an anterior fornix anteriorly, a posterior fornix behind, and you've got two lateral fornices. So in terms of the layers of the uterus, you've got an outer connective tissue layer, which is called the perineum.
So it can relate to when persons are having disease problems. I want you to put down fornix, please.
What's the other
The
one?
fornix. That space that's in front, to the back, and to the sides of your cervix that's protruding into your
Next cervix.
vaginal canal.
Fornix.
Vaginal fornix, let's put it
But
like that.
let me put it here, your fornix here and here.
Right here. And then as you
Because
can
it
see
has-
from this cross section, you've got a thick
You guys got it, fornix?
Fornix,
All right.
yeah.
So let me just move on.
Got it?
I put them, the definitions.
You got it now,
In
Judge?
terms of the layers of the uterus, you've got an outer connective tissue layer, which is called the perimetrium. I'm drawing this on in red here. And then as you can see from this cross section, you've got a thick middle layer of muscle, and this is smooth muscle. and It's
Myometrium.
important during labour for this smooth muscle to contract. And then like
He said the perimetrium, right? Then he talk about smooth and thick. What is about, what do you understand by smooth muscle? Why you shaking your head like that?
No, I'm just asking.
All right, because when you did the muscular system, you talk about voluntary and involuntary,
Involuntary muscle.
striated muscles and smooth muscles. You have control of the striated muscles, which are your skeletal muscles. The smooth muscles, you do not have control over it. So basically, you don't have no control over your uterus. Right.
lining the cavity of the uterus, you've got the endometrium. So you've got the endometrium.
And stay focused on the endometrium, okay?
Inside.
Stay focused, not so much the perimetrium. Yes, you're gonna be hitting hard when we're talking about now the smooth muscles of the walls of your uterus, because it has a lot to do with the pushing the baby out and a lot of different stuff. But the endometrium, when you do the part of your maternity nursing that deals with the ovulation cycle, and when that endometrium is built up every month for the receiving of that egg, and it don't happen, that fertilized egg, that is what is shed every month as your menses. You guys with me? All right.
Forgot to mention it's called the myometrium. And then, like I mentioned before, you've got the perimetrium, which is the outer connective tissue covering. So the endometrium, which is the internal mucosal layer, is interesting because it thickens during the menstrual cycle and it disintegrates at the onset of menstruation. So it's under hormonal influence, so it varies in thickness during the menstrual cycle. So the lower part of the female reproductive tract is the vagina. And this is a fibromuscular tube. And as you can see, it lies anterior to the rectum and the anal canal, and it lies behind the bladder. So you can see the bladder here and the urethra here. So those are the anatomical relationships. So the vagina runs between the external vaginal orifice up to the cervix, to the external of the cervix. And this internal end of the vagina is known as the vaginal vault. And just like the uterus, the vagina has three layers. You've got the outer connective tissue layer, the middle muscular layer, and you've got the internal mucosa. So, rotating this model round, you can see that the pelvic cavity is lined by this flat sheet of peritoneum, which is continuous with the peritoneum from the abdominal cavity above. And this peritoneum, which sort of drapes over these pelvic viscera,
All right. Remember again, in the abdominal cavity, it is lined with the peritoneum. All the organs, peritoneum, in the abdominal cavity. All right? And remember this, because this is where when you have all these things, the peritonitis, why it's so deadly and people die. Okay?
is known as the broad ligament. And you've got various other ligaments attaching to the uterus and attaching to the ovaries, which carry vessels and support the viscera structurally. And I won't talk about these now, but it's important to be aware of this flat sheet of peritoneum which is draped over the viscera, and it's called the broad ligament. And this sheet of ligament which is draped over these organs forms various pouches. So for instance, anteriorly you've got this little pouch here called the vesico-uterine pouch, and posteriorly you can see how this pouch forms behind the superior end of the vagina and behind the uterus, and this is called the recto-uterine pouch, or the pouch of Douglas. So just to be aware that this peritoneum drapes over the uterus, and you can see the intraperitoneal ovary here. So that's a brief introduction to some of the elements of the female reproduction.
All right, guys, turn the lights on, please. Now that was a brief introduction.
To this hollow organ, which has thick muscle.
Now the fornix. Look up the fornix, please.
Fornix of the vagina.
Just anybody who find it, just read, please.
Fornix of the vagina are the superior portion of the vagina extending into the recess created by the vagina portion of cervix. The word fornix is a Latin word for arch.
Bless you.
Can the fornix be infected?
Yes.
Let's read, please.
Read it.
Read? I don't know nothing to read.
Tell her to come and history.
I don't know nothing to read.
What is doing that?
What's what?
Mm-hmm.
Are you alright?
I'm tired.
Wake up, wake up, wake up, wake
Turn
up.
the lights, please.
Wake up.
Right. Actually, just now about the fornix can be infected. Anybody found anything?
Hey, there's a furnace in the brain too.
What do you
There's a furnace in the brain too.
the whole body attached?
Put fornix of the vagina.
Hmm?
You know, let's get it right.
The fornix is just an opening on either side, or like four sides of your cervical. The fornix of the cervical area. All right. Just hold here. Let's just move on. We're gonna read up more on this in the fornix.
FSH.
All right. You guys were looking just now. Do you understand what you were looking at? That's why I did not say anything. So anybody can just tell me. Somebody say yes over there. Who was that? Rose? So what did you understand?
Understand that the hypothalamus and the pituitary gland send the signal on the hormone throughout the testes and the ovaries to stimulate them.
Exactly. Good. What you saw just now, they showed you, and then they just showed you here. And that is very good. To show you what the pituitary gland, the ovary, and the uterus, and what parts. And here is like you showed the release of the ovum. Turn lights on, please. Before you can have the release of the ovum, certain things gotta happen. You have to have your FSH, follicle stimulating hormone. This is important. Because in your ovaries, you have these different areas that develop the eggs. A couple of eggs are developed every month, but usually just one. Sometimes we have two be released. But usually one egg or one ovum is released. Now in the ovary, there's something called the Graafian follicle. And it's in the Graafian follicle you have the development of the eggs. You also have the production of estrogen. Of course, you know estrogen has a lot to do with the female sexual characteristics. And now as this egg develops in the Graafian follicle and it reaches maturity, at maturity, the Graafian follicle opens up. And when it opens up, it becomes something known as the corpus luteum.
Luteum.
And it releases that ova, that egg. But the work of the corpus luteum don't stop. Because this egg now, and when you talk about the fimbriae, the little fingers that pull the egg, right? And pull it into your what? Infundibulum, and then into the ampulla, right? The corpus luteum will now change its function. The function now is that it's going to start producing something called progesterone. And progesterone is responsible for maintaining the pregnancy. So until another function of the uterus takes over from that, it will work and then it will dry up. In the meantime, it will produce that progesterone. Now when that egg leaves that corpus luteum, it goes into fallopian tube. And we said the level of the ampulla is where you find the sperm will go to fertilize the ovum. And at that time, the fertilized ovum, we're going to change the name. And we're going to call it a zygote, right? So it's a zygote now. And it continue its merry way to go to implant into your endometrium. And when implanting your endometrium, then we have the development of the fetus, right? If implantation don't take place, based on that ovulation process, you find the endometrium is going to be what? Shed as your menses every month. And of course, religiously, you know that at that time of the month, especially the Muslims, don't want to have anything to do with a woman because it is getting rid of their waste. and you don't have anything to do with women. Also, a woman usually use one hand to clean herself. And when you're in that community, you can't use that hand to feed persons. Right?
They don't eat, they don't cook too?
That's just we are transcultural nursing. For transcultural nursing, once you're having women in the Muslim community cannot feed their husbands or guests or anybody with a hand that they clean themselves. I think the right hand or something, they can't do that. In fact, many years ago, a girl from Gambia, she came with swell to her eyes and face, and I was like, why was it? Did somebody beat you up? And she was crying, but she didn't want to start. Then later on, she talked to me. She told me that the person said they had at the end of this fasting for the Ramadan thing, she was giving, not the end, actually the end of fasting for that day. She's feeding the guy, and inadvertently her hand was touched something she shouldn't touch. And he smacked her in front of everybody. And that's their culture, that's how they do it, I guess. So menses is not looked upon favorably in certain societies. Okay? All right. So you have this implantation of that fertilized egg into the uterus. Let's forget something with
Mm. Amniocentesis.
All right, I'm going to show 2 short videos. Let's now look at the ovulation process. I'm going to go travel the egg. No, it's actually starting.
Ovulation.
All right, turn the lights, please.
At the start of the
Still
menstrual
looking?
cycle, a cohort of follicles starts to grow, but generally only one continues to develop. This follicle is referred to as the dominant follicle. In its interior, the follicle contains an immature oocyte. This follicle increases in size by 1 to 2 millimeters per day. The follicle produces estrogen and causes the lining of the uterus, the endometrium, to thicken. Around day 12 to 14 of the cycle, the follicle has grown to the size of about 21 millimeters. The rupture of the follicle ensues, which is called ovulation, and the mature ovule is released. The fallopian tube's fimbriae move towards the ovary and catch the oocyte that stays near the ampullary zone of the tube, waiting to be fertilized. If sexual intercourse occurs, the semen deposited in the vagina starts its ascension into the tube, and the sperm eventually arrive at the oocyte. One of these will succeed in penetrating into the interior of the oocyte. One day following fertilization, a cell with 2 nuclei is observed, at which point in time it is called an embryo, and it begins to divide itself. 2 days after fertilization, the embryo is made up of 2 to 4 cells and moves along the tube in the direction of the uterus. At the end of 4 days, the embryo continues to divide itself, at which point it is called the morula. And the interior of the embryo has an area filled with liquid, and this is called the blastocyst. The blastocyst migrates to the uterus and sheds the surrounding membrane, process of hatching, and the embryo begins to implant in the endometrium of the uterus.
Ovulation starts when the pituitary gland releases the hormone FSH to start the development of an egg. LH, another pituitary hormone, helps the egg mature, then triggers its release. Let's see what happens once it leaves the ovary. Fimbriae form a finger-like fringe on the end of the fallopian tube. Their waving motion draws the egg across a small space in the body cavity and into the tube. There, it will either be fertilized by a sperm or dissolve if it's not.
All right, lights please. Okay. Now, just quickly recap on the ovulation process. Now, you fully get it totally. For ovulation to take place, there are get 2 hormones. Follicle stimulizing and luteinizing hormone. Now that area within the ovary, which we call the Graafian follicle, put on that word, because you did that before, so you know the Graafian follicle. So the Graafian follicle is where this going to have a couple of eggs, but only one will become what we call the dominant, and that will mature and start to growing. And when that egg matures, reach a point now, it becomes an ova, and it's released by the ovary. When it's released by the ovary, from the Graafian follicle, it enters the fallopian tube. Now, whilst it was developing in the ovaries, you had another hormone was being involved, and that was estrogen. Estrogen. Now that egg, that ovum or ova, enters the fallopian tube, and at the level of the ampulla, you have it being fertilized by the sperm. And after it's being fertilized, it continues, take about 4 or 5 days before it gets to your uterus. Like I said before, you don't want to remember the infibulum or the isthmus, but you definitely want to remember the what? The ampulla, because that's where fertilization takes place. So now when that egg becomes fertilized, it is now known as a zygote. But it don't remain as a zygote. As it moves down the fallopian tube, it now changes to something called a morula. And by the time it reached past the isthmus, it now become the blastocyst. And it is a blastocyst that now becomes implanted into your uterus. So now the blastocyst is going to happen. And the grafted follicle that had released it continue to produce progesterone, which maintain
Moisture.
the pregnancy. The estrogen was causing the endometrium to what? To develop for the, or prepare the bed. Now the progesterone is trying to maintain it.
Maintain the pregnancy.
Okay, so the blastocyst gets in there, impregnated or implant, and then it starts. You got to know these different sections as we go through the pathophysiology. Okay? So when that impregnation takes place, you have development of this embryo. I'm using the word embryo. Blastocyst, embryo. Before we start talking about what? A fetus. And we don't talk about a baby once it's inside of the uterus. Once in the uterus, by the time we reach the 4th week, talking about fetus. By the 8th week, we got some changes. And there's where you're going to do your FHR. Please put this down. Because you're going to be reading these things coming up. And FHR is very important because you got to know the different types of FHR.
Fetal heart rates.
So the fetal heart rate. So when you're doing your monitoring, and when you're doing the Dopplers and all kind of stuff, right? You have to know the FHR. No two ways about it. You're not knowing the FHR as if you're being a maternity nurse, a obstetric nurse. You're doing it because you're doing it as a student and you're required to do it. So you're not going in depth. You're just going to what you need to know. And the fetal heart rate. When will you hear the first fetal heart rate? So that's where we go into the developmental cycle. So put down FHR. A word I want to stay focused on is your blastocyst. Stay focused on blastocyst. Now, let's look at the word blastocyst first. What is blastocyst? Anybody please read loudly so we can move on?
Blastocyst is structure formed in the early development of mammal. It possesses an inner cell mass, ICM, which subsequently form the embryo. The outer layer of the blastocyst consists of cells collectively called the trophoblast.
All right. The blastocyst gets implanted, right? And it says it starts to what? Mature. So it divides. And start to form into the embryo. Now that's blastocyst, right? Take the blastocyst. Now move to a trophoblast. Or trophocyst. TRO.
TRO. I didn't spell it right. TRO what?
Trophoblast.
TROPHO.
Trophoblast.
Thank
So
you.
what's the trophoblast?
Trophoblast.
Can you spell that?
Stitch S5D. What is a trophoblast?
Trophoblast, okay, I got it.
Anybody?
Right.
A layer of tissue on the outside of the mammalian blastulus, supplying the embryo with nourishment and later
All right.
forming the major part of the placenta.
So that trophoblast becomes your what? Placenta.
Placenta.
Guys, stick with the sequence. The blastocyst becomes impregnated into the uterus, in the endometrium, right? And then in implantation, the development continues, and you have a wall being developed called the trophoblast. And eventually this trophoblast is going to become your placenta. You guys read it? All right. Now when this placenta is developing, you're going to have other things happening. This embryo will need nourishment, right? How's it going to get the nourishment?
Through the placenta.
So we got to get the nourishment. It's going to be coming from who?
Just the
The
mother.
mother.
The mother.
And so it must be a way to take the nourishment from the mother to the baby.
placenta.
But this baby got a what? A wall around it, right? So let's look for the word umbilicus or umbilical cord. Umbilical cord. Please look it up quickly.
Umbilical cord. Umbilical
Cord. There you go.
cord.
The umbilical cord connects the baby to the mother's placenta. During fetal development in the womb, the umbilical cord is the lifeline to the baby, supplying nutrients. After birth, the cord is crumpled and cut.
All right.
Eventually, between 1 to 3 weeks, the cord will become dry and will naturally fall off.
All right. What we're looking at here is that it provides nutrients. But what I want you to do though, I want you to look at the image of the umbilical cord. Because that's where you're going to be looking at the pathophysiology. What are the images that you look at with the umbilical cord? I tell you what you see in the image.
It's a long cord, white. Then after get dark.
Cross section of the umbilical cord. The umbilical has some things in it. What does the umbilical cord has in it? Come on, guys. Look at the cross section. It's very important for you to know this.
Okay, let's see what it has in it. I'm gonna tell you. Oh wow. One vein, which carry out oxygen, nutrient-rich blood to the fetus, and 2 arteries that carry deoxygenated, nutrient-depleted blood away.
So you have a vein. It's taking nutrients and what have you in there. And then you have the arteries, 2 of them, that takes, know this guys, because later on with the pathophysiology, you have conditions, disease conditions that affect the development of the baby. Sorry, not the baby, the fetus. Alright? Alright, let's move on. Now, around the baby, you gotta have some kind of protection. So we go with amniotic fluid. So let's see what the amniotic fluid is about.
Amniotic fluid protects the growing fetus and promotes normal prenatal development. It protects the fetus by the following actions: cushioning against impact to the maternal abdomen, maintaining a stable temperature, promoting normal prenatal development by the following action: allowing symmetric development as the major body surface folds towards the midline, preventing the membrane from adhering to developing fetal parts, allowing room and buoyancy for fetal movements.
If you don't have this amniotic fluid, baby's gonna die.
Baby die.
So that's what it's swimming.
And you know when persons say my water bag burst, that's what they're talking about, right? Amniotic sac rupturing and fluid coming out. And they said protects the baby, cushions the baby, just like how your brain is cushioned by the cerebrospinal fluid. You have the amniotic fluid, cushions the baby there, protects it. And you find that some people who are angry at a person who's pregnant will hit them in their abdomen.
Oh.
And when they hit them against
You
the
never hear
abdomen, the only thing that will pretty much protect that baby
Como
is
tá
their
fazendo
amniotic
Yeah, when they don't want the baby.
fluid. Right?
Where have you been, Nadash?
You know, sometimes persons go through different stages in their life, including relationships. And in some relationships, a person may not want to be pregnant or want to have a baby. And they know they can stop the development of the baby by rupturing. So they punch the person in the belly or they kick them in the belly or whatever they do. And believe it or not, it may sound weird, but do your research.
She don't believe it.
Some
The baby will survive, of course.
people, some persons will engage in rough sex.
How is the other word?
So
just
that the
search now.
person will not know
Amniotic fluid?
that their intention is to get rid of the baby. It will seem as if they're loving and caring at that point by engaging in sexual intercourse, which is a bonding. But they're not trying to bond, they're just trying to what?
Kill.
To get rid of their baby without saying that they hit the person or something of the sort. Okay? Now, people themselves, women themselves, I should say, but the women themselves who don't want the baby will do things to stop. And what they do, they will want to go for abortion, but when they go for abortion, you know, the Planned Parenthood and all that sort of thing, we know in a lot of states now, when to reach a certain weight,
Stop pointing finger.
you're not allowed to have an abortion, even if you are raped. If you're raped, you still have to maintain, yes. And if you go and try to have an abortion, it's not going to happen in certain states. Abortion is not allowed in certain states of the United States.
In some countries also.
All right?
So you go to another country and take it
Tell
out.
what's happening right here in America. A lot of people can't afford to go to other places to have it.
Right
Right
here
here
in
in
New York.
America, that's why you had those Planned Parenthood. Because a lot of Christians, and Christians especially, do not believe in abortion.
Yes.
And they have bombed, including having people who have been killed, when they bombed clinics that do abortions.
Christian.
I saw
Now-
something like
Right.
that.
And
Christians
now
can-
what they're
Christians can do
doing,
that.
they are getting their
Wow, that's
their
crazy.
representatives, really
Yeah,
in the Senate or the Congress,
Christians can do that.
to go up against it. And especially
That's
who
crazy.
is doing this, you find the Republican Party.
Yes.
And the Republican Party is big on this.
Uh-huh.
And they have stopped a lot of abortions from happening. And in a lot of the states that have Republican governors or what have you, that's out the window. All right?
No more abortion.
A lot of changes is happening because of, and this is where we go to religious cultural values are involved. And this is where we look at transcultural nursing with maternity, right? Where you have in places that where two women will decide to adopt or have been pregnant to
see
get
another
child,
question?
it is not allowed in
800,
states,
okay.
a lot of
This
states
is my
anymore.
question, 800, all
It's
right.
stopped.
That's the average, but it
They're
could
not
be
allowing
around
it.
600.
Okay. Mm-hmm.
Well, how you measure?
The
How do
teaching
you measure it?
of
Sorry, teacher.
gender rights
He will know.
is not allowed. In Florida, they put against it. You're not allowed to teach it to students.
Uh,
But what is very important, and I hope you guys read your news about this, because as nurses, you have to remember this. And they're not allowing the teaching of, and they call CM something, CRT or something like that. Race. Teaching about race in classrooms is not allowed. And that's, the Republican Party is doing that. They said it is not necessary to teach children about race and the effect of what been happening to black people in America. They don't want it to
They
be
don't
taught
want
in the
that
classroom.
They don't
That's
want
good.
that.
know
That's
history.
good.
They don't want that
Guys,
anymore.
That's good.
You
That's
guys
bad
listen
history.
to it and be very thing, I think CRT they call it something, critical race teaching or something like that.
They don't want that.
It's on the
That's
news.
not real history.
It's all over the news.
That's false
They
history.
do
That's
not
white
want it to
history.
be taught in classrooms.
Look it up.
So
That's
basically,
that's
they're
white
stopping
history.
it.
That's not true
That the
history.
children can't talk
That's
about
white
what
history.
Malcolm X and these other black guys did.
What do you think happened
They
before
don't want that
Columbus?
anymore.
What happened before
Right,
Columbus?
so that is what's gonna be happening to our children. Listen, guys.
Nothing happened before Columbus?
All right, moving on.
Professor, I have a question.
Mhm.
How do you measure the amniotic fluid? Because they said it has to be about
800
800
or
ml or 600 ml
600.
for at 4 weeks term.
You do something, the test.
34, but 40 weeks. 40 weeks.
All right, guys.
How do you measure it?
Guys,
Do you know?
stay please, stay safe. And when you go into your intrapartum, we'll be talking more about that. But there's something we do, you want to find what's happening with the fluid and what's happening to the baby, they do something called amniocentesis.
Synthesis.
All right, so look up, put on the word.
Amniocentesis. Amniocentesis.
Yeah, it's right there. Prenatal test that can diagnose genetic disorders such as.
Huh?
Oh, when they inject the.
Huh?
Before
What happened?
I had a baby. They
Huh?
give me a medication, they took me and they wanted
They
me
take
on
some of the
bread.
What is that?
The baby was premature.
They push a needle.
Put something in your chair?
They give me
It's an invasive procedure.
Amniocentesis?
Amniocentesis. Go ahead.
Is a prenatal test that
Ready for
can
some
diagnose
from
genetic disorder such as Down syndrome and spinal bifida and other health issues and on newborn baby. A provider use a needle to remove a small amount of amniotic fluid from inside your uterus, and then a lab test the sample for specific conditions. It's still not telling me.
All right,
Can
let's
I-
turn the light for a moment, please. This is just, by the way, this is just ad hoc into this.
to school.
CRT, up there, explaining critical, what's that? Explaining critical race theory, why it's caused a stir in schools, why Americans are so divided over teaching race theory, and critical race theory in public schools. That's all I wanted to show you.
I have some more to read on amniocentesis.
I would like you guys, as black nursing students, to read up on CRT.
I will teach my kids.
All right?
Is that T?
Please look up
AMN
for it, okay? CRT.
NI
It's gonna affect
OS OCENTESIS. Mr. West, I have.
Définition c'est-à-dire comment le faire une
Just turn lights off here, just show one more thing on this before we go. You see down here? No CRT in our schools, PS, we vote. And you see who we're holding it up? See the call of the persons who hold it up? That's all I want you to guys to understand. And, or to put the light on. What you also want to know is that what's how it's going to affect your grandchildren and your children.
I'm looking it up too.
It's going to affect them very much. Right? Opportunities to understand what our past. Those who forget the past are condemned to repeat it.
Repeat it.
We can't remember what happened in our past. You know, and when I see this and I hear it, it really bothered me. Because when I think about people like those black nurses who did more for the people, for the white soldiers, and they give Florence Nightingale all the praise, and the blacks didn't get it. That's why we still fight it. We read
Yes,
Nurses
it's
Week,
true.
Black History Month, and the nurses for 2022, read it please. What the nurses are saying, black nurses are saying, but what's happening still today to us nurses. And we need to remember this. And don't just say, I'm being a nurse. You're going to fail, you're going to meet a lot of obstacles and challenges in your way. There's still a glass ceiling for
Over
us
our
as
head.
black people. Very much there. And because we had a party, and I'm not teaching politics, but because we had a party that was in there, who was all about pushing the race gender thing, right? Like Green going and speak to people who are members of the white supremacists, and she's a member of parliament, going and talking about all this nonsense. Guys, do not forget where you come from.
Oh, I'll teach my kids.
Don't forget where you come
I
from.
will teach my
You will
kids.
meet you. I'm not asking to don't hate
Oh,
anybody,
But
but at
you
the
have
same time, be aware of who you are.
who you are, that's
If
it.
you're not aware of who you are, you will have problems. You will go and apply for a job and have better qualifications than somebody else,
And they give you
and that
the-
person will get that job in front of you.
Yeah.
But do you accept it? No.
It happens to me.
You don't accept it. You gotta keep
Because
saying,
I'm not
no man,
Spanish.
this is not the way it should be done, this is the way it should be done. And this is what we will do.
They told me, oh, I didn't
Critical race, and they kind of erase things from the history, that's what's bothering me.
happened to me. No joke.
And I think I told you many, many years
I was on
ago,
the phone.
all the nice things that they have in Italy is a black Roman emperor that they don't want to talk about. He built all those waterways and all those fancy stuff. But guess what? Even his images, they try to take away all the images and break the statues and what have you. That's why in American history, people who came from Italy were not considered white. And them same Italians who be running around the place, and you can read it up. A lot of Italians who came here, they were not allowed to go to white institutions. And now they're one of the most racist set of people we got.
But Professor, I have a
Right? But
question.
that's just life.
Even they don't want those kids coming afterwards to know the black history, but when a black person make it in America, the first thing they throw at is the first black. You see that judge that become judge, the first black judge. Why they have to throw it that way if you don't want to teach our children
The
that?
good thing is that she become, and this is what influence is like. I'm sorry, I'm getting a little carried away. Clarence Thomas, who was one of our black Supreme Court
Judge.
right? What did he get into problem recently for?
Sexual harassment.
No.
No, sorry.
His wife
His wife, right.
supported who?
Trump.
And she is what? White.
She's white, yeah.
She supports Trump,
She went
and
to
not she only
the
support Trump,
January
she
16th.
sent a message the same what they should overturn. And he, that's his wife.
That's his what, yeah?
And that's why they say he should not sit on certain committees.
Mm-hmm.
Because influence people influence. People influence. And you're black, stay black.
Yeah.
She's white, she makes sure she did what
Where's
she
my
had to do
stuff?
For our white people, it's true.
Right? I'm not teaching race, but I'm just telling you what it is.
She was on
Right?
the insurrection.
What it is. And can you imagine that? I'm a black Supreme Court justice. And
My wife.
oh Lord, have mercy. All
All of
right.
them married
I wanna read more on that amniocentesis.
No,
Let me too.
I heard you when you were giving that over there with the amniocentesis. There's a lot that you can get when you do the amniocentesis. You can get more information out. I want you guys to read more because there's some other things I really want to go far before we close off here. All right. So you can do some tests, amniocentesis, to see how the baby is what, how it's been affected.
Long maturity.
What's going on, right? Now, when the baby is in there, we talk about it being protected and all that nice stuff. But let's look at the muscular organ. That's smooth muscle, which was what? What's that muscular organ you said smooth muscle again? The uterus. And the uterus is where you have the what expanding and building. Do you know what I mean? The
Fetus?
the placenta, right?
Placenta?
The placenta. Now as the placenta gets bigger and bigger, your belly gets big, right? And you get a nice little bump up here. A lot of things happen, right? Remember to show you where the bladder was, and to show you where the colon was. When women within the first trimester of pregnancy, they have what? Frequent urination. Guys, when you got pregnant in the first 3 months and you run to the bathroom
A lot.
for the mothers,
A lot.
right? Because it's developing. As it's developing, it's pressing up against your
Uterus.
You with her.
bladder.
Bladder.
And remember, your bladder has a zygote. And when the zygote get that pressure on it, you know zygote. Why you guys make me say zygote?
Your pelvis.
What is that?
Your pelvis.
The muscle.
tired.
What's the next one? Everybody say yeah.
The muscle.
The
that
trigone.
Trigone, yeah. The muscle.
So when you have the trigone, because the trigone send messages to your brains that say what? The bladder is full.
Yes.
So when you have this developing uterus pressing now against the bladder, it's going to put pressure on the trigone, and the trigone sends a message, hey, I want to pee. And the woman will run to the bathroom. But that's within the first trimester of pregnancy. By the time you get into the second trimester of pregnancy, it eases off. You don't run to the bathroom as much anymore because the development, as I said, becomes more abdominal. And then now when you go now back into your last trimester, your third trimester, that is when it starts to go down back
Down
into
again, you pee a lot.
pelvic. And there's where you start to do what? Pee again.
Yes.
You start run to the bathroom again, right? So that's basically the rationale, the physiology, how it works. Right? This development and how it affects other organs. Now, sometimes when the uterus or the placenta is developing, you get a problem. And that problem is called placenta previa.
That up.
Look for placenta previa, please. Placenta previa, P-R-E-V-I-A.
Placenta previa is.
Please put that down so you do a lot of reading at home.
Placenta previa is an implantation of the placenta in the lower uterus. Placenta previa, an implantation of the placenta in the lower uterus. As a result, The placenta is closer to the internal cervical OS than to the presenting parts, usually the head of the fetus.
All right. Placenta previa. It has a lot when you're going to talk about delivery, how that baby's going to be.
First stage of
All right.
delivery.
So, you don't talk about the uterus. So, placenta previa. And there's abruptio. So, let's look at abruptio now.
Abruptio.
Central abruptia.
Abruptio?
Abruptio they're talking about.
How you spell abruptio, sir?
I think it's ABRUPT, and the last couple of words is IAE or IOO. Placental abruptio.
Placenta previa.
UP.
Once you put it, it will pop up.
Yeah.
Okay.
Abruption.
It could be, look, you're gonna see abruption, you're gonna see abruptia, you're gonna see different things. But the same thing, all gonna be the same thing.
Placenta abruption occur when the placenta separates from the inner wall of the uterus before birth. Placenta abruption can deprive the baby of oxygen and nutrients and can cause heavy bleeding in the mother in some cases.
All right, the mother's gonna get heavy bleeding, but the thing about this is a medical emergency.
Emergency.
Placental abruption, the baby will die
What's the difference
because it's not gonna
between
get what?
emergency and what was the
Oxygen.
other word? Emergency and
So please put down your placental
Emergency
abruptia,
and,
placental abruption, however you want to write it. You're going to find both of them in there, but the same thing.
what's the other word?
That's another one.
It is a
When you have to
medical
know which one's
emergency.
Emergency and emergency.
And it's not just sometimes the woman say, you know, she passing blood. You have to find why she's having the PV bleed. What's happening?
Mr. West, there's two terms, emergency and another one, imminent, something like that. Remember?
It's emergency.
Emergency and another
So you know
one.
which one to put. You give that in your test. What's emergency and
When a situation is an emergency, and then it is also a
like
All right. Emergent situations or
Emergent.
urgent
Emergent.
surge situations.
exactly.
emergent, right?
So if you mark
Urgent.
from
Okay.
Emergency
emergent,
and
okay.
urgent.
something urgent means that you need to take care of it. But emergency means that right away.
Right now.
Mm-hmm.
Yeah, that's what I mean.
It's a time factor. Urgent care, like you go over there, you have an urgent care center, right?
Mm-hmm.
But when you go to the emergency room, that's a whole different story. You don't go to urgent care if you get a gunshot wound. You go to their what?
Emergency.
All right?
Yeah. It wasn't.
No, it wasn't.
There was a question like that.
You took a different test.
Urgent or emergency.
All right, guys.
Sure.
Stay with me, stay with me. Got things to do. Gotta do some reading. All right? Any questions on to now? Because I tried to do it step by step so you can understand the sequence. Remember, each part of the female reproductive system can be affected during maternity,
Yes,
right?
definitely.
Each part.
Or anything.
They're gonna put them in a lot
I want
of
my
absolute bed rest or what have you.
this.
It's a serious
Give
one.
me
What do you need?
my charge.
A charger?
All right, guys.
Thank you.
Quiet. Let me, let's stay focused.
Yeah.
All right, placenta previews where we coming to do in the intrapartum stage, right? Because we haven't gone to intrapartum stages yet. You got FHR. Please read up on the FHR. When is the first heartbeat? When will you hear the first heartbeat? At what week?
Add
If it's
to
gonna
your
be 8 weeks?
to your group.
Or how
And then
long
you
it will
could
be?
have the thing to
When will you, when is it determined to be
add
a full-term
add
baby?
her.
Full-term
Add her to
baby?
your group.
Is it 39 weeks?
Add her to your group.
What is
Who?
Full-time baby.
39?
Vivian.
What is a
Text me
I'll put
the
it down.
number.
preterm,
Preterm,
post-term?
preterm, and post-term.
And you
Preterm
wanna
and
put the
post-term.
numbers.
Preterm. Preterm,
Babies who were born before 37 weeks.
post-term.
Why is it preterm babies a problem? Those are things you want to look at. Look at the dates. Because remember, development is what? Taking place. So if you have preterm, it means what? The baby is still developing. Cells are still, until the time the baby is pushed out, the fetus is pushed out of you, development is still taking place. You guys understand?
Mm-hmm.
So that is why with preterms, they usually put them in what? Because they need that extra assistance to develop, continue the developmental process.
You got it?
Years ago,
I'll look for it.
when people have problems, be it like post-term, they will not, the woman will be crying, right? And then the woman will die in childbirth, because they didn't know what to do.
Oh.
But then we got a person who was untimely ripped from his mother's womb. And what I mean by untimely ripped means to kill the poor woman
Mm.
to get the baby out.
Oh.
And that's how we came about with the word cesarean section. Because the person who was untimely ripped from the mother's womb was a man named Julius Caesar, the emperor of Rome. Which all the Roman Catholics should be great about today, because he's a man that went conquering. Had the Egyptian, what's her name? Cleopatra. Anyway, that's how the name cesarean section came about, because of the word
Caesar.
Caesar, who was untimely ripped from his mother's womb. Lord have mercy. Father,
My
put the
God.
word in its eyes. All right? So, people don't die like that anymore. That means that remember I give you the word, ripening of the what?
Cervix.
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 The cervix don't ripen, so they can't get what? Vaginal birth.
Vaginal birth.
Mm-hmm.
And now the baby is ready to be born, but the baby can't be born because of.
It's loose off.
So it go into the 42nd week and all that sort of stuff, and next thing you know, the woman dies. But in this modern age, we got all kind of stuff. You don't find these things happening. But back in the days, yes. Or people who live in those communities, like I was looking at something about Tibet. Those women walk whole day while they're pregnant just to go to a clinic, and then walk back home whole day. I was like, are you kidding me? In this modern age, you got people walking all day to go to a clinic? What are they doing? Pregnant. And they're not walking the road. We're talking walking up hills, going up hills with stick like that. Like, damn. That's serious, man. I guess if I was a man in that place, no woman getting no pregnancy, you know. Because she might want me to follow her. As old, I gotta walk back and forth 2 days walking. I'm sorry, that's kidding wrong. All right. You also want to look and pay attention to, remember we talked about ectopic pregnancy?
Mm-hmm.
Look at, put down ectopic pregnancy. I want to read up because we're going to fall through next week. We're not going to only do, we're finishing off this because we got to move on to something else. All right? Now, all right. For a woman to get pregnant, she gotta have what? Sex, right? Is that true?
Necessarily, no.
No, not necessarily.
They can have what?
Money.
IVF.
What's the idea?
IVF is vitro.
Intravitreal fertilization. So you could take the egg of the man and put it together and then put it inside of a surrogate woman.
Fertilization.
Or they can have
The baby.
someone carry
But
it for
the
them.
genetic makeup of it is there. Man who donated the sperm and the woman who donated or
They could also
so it
have
can be
somebody
done
carry it for
outside
them.
of there
They will.
and put it to the woman, whoever, any woman. You had some old women who took it for their daughters and that sort of stuff, right? So anybody can do it. Once they have a uterus that will work.
Now they said they're creating machines. Is that true? Because you don't know what to believe. They're creating machines to carry the baby. It have a light and
I
it water.
haven't seen that one as yet.
No, I saw that.
That's a movie. That's a
It's
movie.
not a movie.
That's a movie.
So it's not a movie. I know
Right,
the
be
movie you're
careful,
talking about.
Be careful, be careful. Go around there with machines of babies, be careful.
No, I saw it. They trying to build that. No joke. In London, they built. I used to be in the hotel industry. I already know they built robot. Now, when you do room service, a machine bring you whatever you order. So I read they say they're trying to build that a machine to carry the baby for you.
All right, they're still trying because I.
Yeah, they're still trying.
All right, they're still trying. They don't have it done wrong right now. But with reference to the woman who is pregnant, those topics are those points I give to you. Now, conception, we said we need a man, and we said how much, when we were doing the male reproduction, we talked about the amount of what? Sperms, right? That you have to be released. If you don't, it's going to have a problem. 2, you gotta look about the alkalinity of the sperm. Because remember, the sperms are going into a very what?
Acidic.
Acidic. So you gotta look at the pH. Don't want the sperms to die as soon as they go in. They have to be protected.
They have a fructose to bring the
Okay?
thing to make it sticky like a protein.
And when at conception, you gotta know when. Not every time a woman has sex, she's gonna get pregnant. If just
she's
before, just after she had her ovulation, she's not gonna get pregnant because the endometrium is now still what? Developing. And that ain't gonna happen. Alright? And there's a specific time. And usually use the testing of the person's what? Temperature, because the temperature rises during the ovulation period. And that's the time you should have sex if you want to have baby. And not, as persons would say, have sex on your right side or your left side and put your foot in the air and you know, those certain things, all right? So look at it more scientific in the sense of the ovulation cycle
Nice
and the body's response.
Nice
And you check the temperature because the temperature of the person rises during the ovulation. So once her temperature, she has to monitor her temperature. Once she sees her temperature rising, she knows that's the time
It's going lower.
buy some Viagra or whatever it is to make sure things happen. Alright? Guys, this is a lot we have to do. We have not even gone fully into conception and into, we got the part where deliveries and the placenta previous. And, we talk about things also, postpartum psychoses, postpartum blues.